In September 2015, global leaders adopted the 2030 Agenda for Sustainable Development. In line with ILO social security standards, at the heart of the 2030 Agenda is the pivotal role of social protection, captured under Target 1.3 on universal social protection and Target 3.8 on universal health coverage. We know that close to half of the global population is without any form of social protection benefit. So the question is, how much would it cost to extend the social protection floor to all?
At the ILO, we have calculated the annual financing gap for universal social protection floors in low and middle-income countries. In 2024, the financing gap corresponds to $1.4 trillion. This amounts to an additional 3.3% of GDP that needs to be invested in social protection to ensure universal coverage.
As you can see, the global averages conceal significant disparities between national income groups and regions. Low-income countries face the largest financing gap as a proportion of their GDP, due to large social protection coverage gaps and low GDP of these countries.
It is internationally agreed that the main fiscal space option to close the financing gap is domestic resource mobilization, which means strengthening progressive taxation and social security contributions.
However, the global community needs to do more to create an enabling global financial architecture that supports countries' efforts in mobilizing resources domestically, through better global coordination on tax matters and efforts to reduce illicit financial flows.
So, what are the figures telling us? They're telling us that we urgently need coordinated national action backed by conducive global coordination in order to build social protection systems and floors which are critical for delivering on the promises of the 2030 Agenda for Sustainable Development.